Thank you for taking the time to view this video on Original Medicare or Medicare Advantage. This video is presented by Senior Pharmacist, a nonprofit organization in Durham, North Carolina that provides free of charge Medicare counseling to Durham residents that are on Medicare or are about to join Medicare. This video is one in a series of videos designed to provide you with information on the various parts of Medicare so you can understand what choices you have so you can make the best choices for yourself. First, note that the information provided in the presentation is general information. There are exceptions and special circumstances that may affect how this information may apply to you. When selecting Medicare plans, it is very important that you consider your own personal situation and make choices that are good for you. As you plan for Medicare, you will have to make a decision between Original Medicare and Medicare Advantage. Each side is independent. You cannot combine different features from each side. Original Medicare is managed by the federal government as a fee-for-service coverage. It covers Part A, which is hospital insurance, and Part B, which is doctors and outpatient services. When you get care, you are usually billed for that care. An important note, there is no annual out-of-pocket maximum on what you pay for hospitals, doctors, or outpatient services. Original Medicare is managed by the federal government as a fee-for-service coverage. It covers Part A, which is hospital insurance, and Part B, which is doctors and outpatient services. When you get care, you are usually billed for that care. An important note, there is no annual out-of-pocket maximum on what you pay for hospitals, doctors, or outpatient services. Medicare calls prescription drug coverage, or Part D, optional. It's provided by private companies. However, if you delay enrollment when you are eligible, there may be lifetime penalties. There are three types of optional secondary coverage. One is a Medicare supplement or Medigap policy. They are provided by private companies to fill in some or most of the gaps in Parts A and B so that your health care costs will have a limit. You pay an insurance company monthly, which then pays for some or most of your health costs. A second type of secondary coverage is Medicaid, which is a Medicare savings plan for those with incomes at 100% or less of the federal poverty level. The third type of secondary coverage is that offered by some former employers. If you have access to former employer coverage, it is important to contact your benefit office for specific guidelines on how to access that coverage. You may have to follow some very specific rules. Original Medicare Option 2 is Original Medicare A and B plus Part D, which is prescription drug coverage. You should review Part D annually during the open enrollment period, which is from October 15th until December 7th. Drugs that are covered and drug costs may change annually. Original Medicare Option 3. You can add a Medicare supplement to A, B, and D, and the supplement will cover some or most of the costs of the Medicare covered care for health, copays, coinsurance, and deductibles. It does not cover drugs. What does Original Medicare not cover? Original Medicare does not cover routine dental or vision care, eyeglasses, hearing aids, foreign travel, nor does it cover cosmetic procedures and treatments, long-term care, over-the-counter meds, or prescription meds. If you want prescription drug coverage, you must get a Part D plan from a private company. Medicare Advantage is also known as Medicare Health Plans or Part C, and they are provided by private insurance companies. They are managed care and must follow rules set by Medicare. Parts A and B are combined in Part C. Part C covers hospitals, doctors, and outpatient care, and you must still pay your Part B premiums. Medicare Advantage is often called pay-as-you-go because copays are almost always required before you receive care. You are also usually required to use a network for services. Depending on the type of Medicare Advantage plan you have, you may not be covered for out-of-network care except for emergencies. Emergencies are always covered. Medicare Advantage may require referrals to see specialists. It has a yearly out-of-pocket maximum for health expenses. It can also include drug coverage. However, drug coverage is not part of the out-of-pocket maximums. Medicare Advantage can include extra benefits that original Medicare doesn't have. Benefits such as dental, vision, or hearing care. Check with the company to determine which benefits the company may cover. Medicare Advantage plans should be reviewed annually during open enrollment period, which is October 15th to December 7th, or during the Medicare Advantage only open enrollment period, which is January 1st through March 31st. Decision time. Which are you thinking about choosing? Original Medicare A and B only without drug coverage? Original Medicare A and B with Part D coverage? Original Medicare A and B with Part D coverage and a supplement? Medicare Advantage without drug coverage? Medicare Advantage with drug coverage? There are many sources available to help you understand the difference between Original Medicare and Medicare Advantage and how to navigate the Medicare system. To set up a free appointment with a SHIP counselor to discuss Medicare, call Senior Pharmacist at 919-688-4772. If you would like to learn more about Senior Pharmacist or about Medicare, or would like to see other videos in the series, go to the website seniorpharmacist.org. You can also call SHIP, which is Seniors Health Insurance Information Program, at 1-800-408-1212 or go to their website. You may also call Medicare 24/7 at 1-800-633-4227. TTY users can call 1-877-486-2048, or you can check the Medicare website. For more information about other parts of Medicare, these videos are available at the Senior Pharmacist website. I hope you have found this video helpful. Please check out the others, and thanks for watching.